Hey team, Colleen had a question about thumb pain, so let's talk about that for just a second. So, question is, pain here in the thumb with like putting your hands down, weight bearing, what could that be? So let's talk about the thumb just a little bit. So if there are two joints in the body that tend to be hypermobile, meaning move too much initially, but over time wear down, cause degenerative changes in bone spurs, and therefore become hypomobile, meaning move too much because there's a lot of bone spurs, a lot of arthritis in there. The two most common areas of the body for that to happen are C5, C6 in the neck. So people who have bad posture, like this forward head posture, that over time they lose the ability to rotate up top and they start rotating at the bottom. So a lot of times degenerative changes in the neck, you see people that have to get cervical fusions over time because they have neck pain and essentially getting pain and numbness and tingling in their hands. So the neck is one area that tends to move too much due to poor posture. And with time, that over mobility, too much mobility, results in the body laying down bone spurs. And then the little areas in the neck where the nerves exit have bone spurs in them, so they get smaller, and then we don't have as much space for those nerves to exit. So that's why posture is very important for the neck and for preventing a lot of neck problems as we age. So I digress. So back to the hand. So Colleen asked about pain in that spot right there. So that is called the CMC joint. So it's kind of the meaty part of the hand right there. CMC stands for carpo metacarpal. So carpo meaning wrist bone, metacarpo meaning this long bone here. So these bones here that we have in our hand, those would be metacarpals, and then the little tiny bones up here would be the carpal. So where those meet in the hand is called the CMC joint, carpometacarpal, and that is also one of those joints that tends to get overused. It moves too much, and then over time, to get more stability, the body gets arthritic, and then it becomes less mobile. So we can have a lot of pain here. As we age, if you look at maybe some older members of your family, especially even females who've used their hands a lot over time, you can see that this bone actually starts to get built up, and you can see the joint, or you can even feel that there's sort of like overgrowth in there, and that's arthritic changes. So typically what ends my career as a manual physical therapist is this pain right here. And there was a therapist that I worked with a few years ago who, anytime between patients, she had to go put BioFreeze on her hands because her hands hurt so bad. So this is pretty much what's going to end my career at some point. So what we need to do first and foremost is protect it. So anytime we do non-weight or weight-bearing activities where our hand is down, say with yoga or any sort of exercise, doing push-ups or anything, instead of having your hand out this way, where that can get pulled back, and that can be stress, we're going to probably try to keep it tucked as much as we can. So yeah, you're going to lose a little stability there. You're not going to be as stable here as you are here, but you're really going to protect that. And that's sort of what I have to do at work too. Instead of really pushing out this way with my thumb, I have to learn to use this and keep my thumb tucked. So that's one thing that we need to do. If the pain was on the other side, the other thing I'd want to look at are these tendons here. So if the pain is on this side, I'd want to look at just tightness in here. We call this de Quervain's tendonitis, which basically means that these things have gotten tight. The way you can tell if pain here or pain here, it's basically just opposite sides of the joint. If it's coming from these tendons, you're going to tuck your thumb like this and then bend down. So I'm going to tuck my thumb, I'm going to wrap my hands around. If I bend down and that reproduces that pain, then it's probably coming from those tendons versus coming from there. So this starts off as hypermobile, too much motion. Over time, it would become arthritic and have too little motion. And then we can have some problems where if we try to put weight through it, it doesn't feel very good. That's something we have to avoid. If it's an issue where it's kind of sliding around too much, it can sublux or get like a little bit dislocated. And what we want to try to do there is just kind of grab it and just kind of wiggle it back until we seat it. That's a saddle joint. It's kind of set up like this. It can move in lots of different ways. So first and foremost, protect your thumb by keeping it close when you can. So if you do push-ups, do them on your fist. Do things this way if you're on your hands. If you're in a yoga position, this is not the best thing for keeping that calm down. If it does feel like it's subluxed a little bit, grab on both sides of the joint like this distract a little bit, so pull away. You just kind of wiggle back and forth until you feel like it gets seated. And I can even feel mine kind of clunk a little bit just because I do have that hypermobility there. Other than that, that's usually it. Protect, reseat, and make sure you don't stress that. Keep the tendons stretched out. You're fine to rub that as you want. I'll put some hydrocortisone, like some Voltaren gel in there, just to try to get it calmed down, or a little medicated patch. I like Voltaren gel just because it doesn't have to go through your whole body, go through your liver. You can put that right transdermally and get that to calm down. So that's about all I have for thumbs. So if you don't have any problems right now, just protect it as much as you can. If you do start to have problems, that's usually where you're going to feel it right in there. So it is sort of an arthritic change. All right, if you get any other questions, let me know. Thanks.